Let's talk about shoulder impingement, arguably the most common cause of shoulder pain, at least in adults. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. And I provide education and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Shoulder impingement or subacromial impingement or rotator cuff impingement, there's lots of different terms for it. It's part of a spectrum of problems or disease conditions of the rotator cuff, from impingement to partial tears to complete full thickness rotator cuff tears. Impingement obviously is the most mild form of that. We used to call it tendinitis or bursitis, but really impingement is more of a syndrome, a spectrum of conditions. It can be small area of degeneration within the tendon, what we call tendinopathy. Yeah, inflammation of the tendon, the tendinitis. Inflammation of the subacromial bursa between the rotator cuff and the tip of the shoulder blade, the acromion, the bursitis. But fortunately, this is fairly straightforward and we can almost always get you better without surgery. Typically, people with shoulder impingement complain of shoulder, maybe upper arm pain, especially with reaching up overhead. So reaching into a cabinet or going to comb their hair. Maybe it's reaching behind their back or trying to reach and hold an object out away from their body. So maybe they have pain when they get the carton of milk out of the refrigerator. Things like that can be very, very common with subacromial or shoulder impingement. They may complain of night pain. You may have night pain where it hurts when you roll on it or it wakes you up in the middle of the night. That can be really classic as well. Fortunately, there's some physical exam tests we can do in our office to make the diagnosis. Some impingement tests. We might test your rotator cuff strength to make sure that it's unlikely you have a tear. And yeah, we're going to get x-rays and we're going to potentially get an MRI if we're concerned there's a tear. But fortunately, if it turns out to just be shoulder impingement with no rotator cuff tear, we can usually get you better without surgery. That usually involves physical therapy, strengthening the rotator cuff muscles, strengthening the muscles around the shoulder blade, getting your motion back, fixing the mechanics of your shoulder motion can be very, very helpful. Occasionally, we'll add a cortisone shot into that subacromial space to help with the pain as well. That can be, in my experience, really helpful for the people struggling with night pain. Usually those two things knock it out, maybe some activity modification, things like that. But it can take a while. We don't usually retreat, so to speak, to surgery unless you've really failed maybe 4 to 6 months of the non-surgical treatments, especially the physical therapy. Then there's sometimes an option. Maybe you go in arthroscopically, clean out the bursa, maybe debride the frayed area of the tendon if there is some, remove any bone spurs under the acromion, the tip of the shoulder blade, and that's enough to get you better. But again, usually that's not necessary if it's truly just shoulder impingement. Okay, have you dealt with shoulder impingement? Does this sound like your problem? I'd love to hear your complaints, your issues, your treatment. How did you get over it? So below this video, describe your experience so I can read it and people all around the world viewing this video can learn from your experience as well. I record a couple of these videos every single week, so subscribe to my video channel. Click the button in the upper right corner of the page to subscribe. You'll get notifications about those videos, and anytime I'm online live recording videos, you'll get notified and they'll get basically delivered directly to you. Thank you so much for watching. I really hope this video was helpful, and I look forward to seeing you right here next time.